passageway between air and food, which is sometimes why those two get mixed up and you choke, right? So, I'm going to go through the parts here, but you'll note when we do the digestive system for this part that there is a little bit of redundancy. So, like, note that if there's one section that's more specific than the other, for example, the pharynx, just know the more specific one, all right? I know there's overlap, but this is because they have to do with both systems. So we'll start with the external nares. The external nares, it's basically just your nostrils, so it's the first points right here where you're going to have air coming into the nose. Now I'm going to jump down quite a few to internal nares, and I'll explain why in a second, but here we have the external nares. Internal nares are depicted by this arrow here. And the reason I'm pointing that out is because the second identification on the respiratory sheet, the nasal cavity, is all of the space in between the internal and external nares. So from here to here, all of this space, if we were to put a sticker anywhere in here, all of that would be nasal cavity. All right. Next we have the auditory tube opening. So remember the eustachian tube or the auditory tube in the ear, internal auditory tube? This is where it dumps out. This little incropping right here, that's the auditory tube opening. All right, next we have the pharynx. So what I'm going to do is I'm going to show you the upper and lower boundaries of the pharynx. The pharynx is the system that's shared by both the respiratory and the digestive systems. So it's basically a passageway where both food and air are supposed to go. So kind of keep that in mind because there's a little bit of overlap between that and another part. But it starts up here. It's basically right past that internal nares portion, comes all the way down here to right here. So basically as soon as there's two tubes, that's where it's no longer the pharynx. When it's just one tube, the one tube is the pharynx. Alright, that's the best way to decipher it. Now it's broken into three parts depending on essentially where it's at, depending on whether it's in the nose, the mouth, or the throat. Okay? The portion of the nose is the nasopharynx, and the line is basically drawn from the back of the soft palate up. So this is the top border of the nasopharynx. This is the bottom border of the nasopharynx right here. Now the oropharynx isn't very big. It's just literally the opening at the back of your mouth. That's it. That's the oropharynx. Alright, next we have the laryngopharynx. That's going to be the area from the oropharynx down to where it splits into two tubes. Now, this area is basically the area posterior to what we're now going to be discussing as the respiratory tract. The respiratory tract sits anterior to the esophagus, so there's some overlaps with the laryngopharynx, which I just said is this is the bottom border again. This is the top border here, and the larynx, hence the name laryngopharynx. The larynx is basically the space created by the top three cartilages in the throat. So I'm going to skip glottis, and I'll come back to that in a moment, but I'm going to jump onto larynx. So this is the border of the larynx right here, and we actually have three models over here on the far table of just the larynx. Okay, so do make sure you take a look at that. The three cartilage that make up the larynx is the epiglottis, which is this guy right here. If you guys swallow, this is the flap that closes, like that. Okay, that's the epiglottis. Next we have the thyroid cartilage, and you'll see it's really thick in the front, but if you follow it around, it actually doesn't really go all the way around. It's just kind of like a front plate. Okay, so we just see it up here. I'm pointing that out because it's kind of confusing getting a cross-section like this, because this fat portion right here, kind of in the middle, actually comes around and loops to this one right here. That's the cricoid cartilage. So both of these combined is the cricoid. And this is also why I think it's a good idea for you to look at the models so that you can get a good idea of kind of the boundaries of that cricoid cartilage, since it's not as clear here, and that thyroid cartilage for the same reason. Okay. Alright, so that's it for the larynx. We'll get into more of this. Oh, no, actually, I keep thinking we're doing digestive system, we're gonna talk about the esophagus next. Alright, so actually we're gonna follow this line down. After the larynx officially ends after the cricoid cartilage. So this is the lower border for the larynx. And again, it starts in the epiglottis. It's literally just the area composed by these three cartilage. After that, we get into the trachea. So if you look next, we just have these small little dashed lines. Those dashed lines are actually rings. So you have rings that consecutively go all the way down the trachea. Alright, so we're going to get into the rest of the respiratory system in a second, but I'm going to go back up to talk about the glottis, vocal cords, and vestibular folds. These three things make up the voice box. Okay? They're kind of hard to decipher. We're going to be looking in the larynx in this region here. We have these two folds, and that's really all we're going to be able to see on our models for what composes the vocal cords and vocal folds. So I'm going to switch to a different view just to help you conceptualize it. So this is the view that you would get if you basically looked down into the respiratory tract, okay? Here's the epiglottis, just to give you perspective. So switching back to that other view real quick. The epiglottis is right here, okay? So if we look again in here, here's the epiglottis. This is the anterior portion, posterior back here. And we're looking down at these folds right here. That's what we're looking at, all right? So those are these folds on either side. Now, the reason I'm pointing this out, because it's kind of confusing, is that the vocal folds and vestibular folds are essentially on the same plane. The only difference is that the vocal folds are this white portion closest to the median. And the vestibular folds are essentially like, I always think of it as like the musculature, but it's basically what opens and closes the vocal folds. And then that's on either side. The glottis is the space in between the vocal folds. Alright, so it's basically the hole that opens and closes to allow air to pass through your vocal cords so that you talk. So with the glottis, I would definitely anticipate that being a hypothetical question because it's not really that easy to point to it, right? It's a space. So for the glottis, I would anticipate a question along the lines of identify the space between the vocal folds. All right, but that's kind of how it works. So vestibular fold, vocal fold, glottis, vocal fold, vestibular fold. Now, if we're going to overlay what we're seeing here to our sagittal cut views, because this is really all we have to identify these things on, you'll see that there's two flaps here, right? Don't let the fact that there's two flaps confuse you, because it often does. One of them is not the vestibular fold and the other one the vocal fold. One of them will contain both of those structures, all right? The way that you will decipher which is which, that outer rim on all the models will be a slightly different color. On most of them it's white, okay? That white is the vocal fold. The fleshy color is the vestibular fold. So definitely a thin line to be playing with. That's definitely a question where if we're stickering it, we're going to sticker it and probably put arrows. It's just too thin to put a full sticker on. Alright, so have I lost anyone yet? Are we all good? Great. I'm going to switch to a different view real quick, and we're going to talk about the rest of the lungs. So to kind of jump back on track with our passage of air that we were working on, we left off with trachea. We're going to pick up again with trachea, but in a different model where we're down in the lungs. So here's another model, just to reorient you. This big patch in the front, and this second little cartilage here. This area here is the larynx. The top portion here is the thyroid cartilage. This next ring right underneath that is the cricoid cartilage. Then these small consecutive rings that you see going down are the cartilage for the trachea. Now this will remain the trachea all the way until here, so this last little ring. At this point it splits into a left and a right primary bronchi, right? We don't go into further organization other than that. I don't know why, but if you were to go further out, you would have secondary bronchi. See, it splits again. We have tertiary bronchi and so on, alright, until we get into bronchioles. We don't go that far down the organization, I'm just explaining that because you need to remember to say primary when you write this on the exam. And remember, you have to say left and right, so left primary bronchi, right primary bronchi. Alright, so with this model you can see on either side you have the lungs. In this model, just to orient you, this is just showing the back side or the posterior side and the anterior side of the same lung, so there aren't like 4 pieces of lung that they pulled off. It's the same piece, they're just showing you front and back on either side. So this just fits on right there, this fits on right there. Those are the lungs. Now if you look, you can see that there are actually lobes. Here's one area or one crease breaking up these 2 lobes, another one down here, and we're on the right side here just to orient you. Now, if you notice on the left lung, there's only 1 crease. You actually have 3 lobes on your right lung, but only 2 on your left lung. So actually lungs are quite unsymmetrical. On the right lobe, the right lung, the lobes are named superior, middle, and inferior, so pretty basic, right? The one on top is superior, the one in the middle is the middle, the one on the bottom is inferior. And again, you can see here, just look for those crease lines, superior, middle, inferior, same on the actual surface of the lung, okay? And for this one, since there is no middle, we just have a superior and an inferior, alright? Now, I'm going to jump back up to the cardiac